Good morning, everyone, and welcome here to Bordeaux for our interdisciplinary seminar organized by the Public Health Network of EHESP. I'm very glad to have you here. My name is Luisa. I'm here with Kalina, Julie, and Agnieszka, and Ruben is also part of our organization team, but not here with us today. It's my great pleasure to present to you Geneviève Chêne, who is Professor of Public Health at Bordeaux University since 1999 and head of the research team here working on HIV/AIDS, which is part of the U897 INSERM team, and working on epidemiology and biostatistics. She's also the coordinating doctor of the clinic epidemiology module of the CIC, the Clinical Center of Investigation of Bordeaux, and she's head of the public health department at the University Hospital of Bordeaux, and also head of the Thematic Multi-Organism Institute of Public Health of the National Alliance for Life Science and Healthcare, AVIESAN. She's been appointed director of EHESP, so the Public Health Research Institute, in March 2014. Thank you so much for being here. I'll give you the floor.
Thank you very much. Just to say hello and welcome to the Bordeaux School of Public Health. You are here, so you need to feel here at home. I will come back to different aspects in public health research in France. But I just wanted to welcome you and especially our speakers from abroad and from outside of Bordeaux who we have the pleasure to welcome here. And I then give the floor to Judith Mueller from the EHESP, who will welcome you as well.
Thank you very much. Good morning, everybody. I'm Judith Mueller from professor at EHESP, c'est l'école des hautes études en santé publique à Rennes et à Paris. Je suis aussi directrice adjointe du réseau doctoral en santé publique. Et je voulais juste vous expliquer un petit peu ce lien entre ce séminaire interdisciplinaire et le réseau doctoral. Vous voyez ici une affiche par rapport à ce réseau doctoral qui a été créé en 2008 à l'initiative du ministère d'Enseignement supérieur et de Recherche avec la vision de créer une communauté de chercheurs et professionnels en santé publique avec une partie qui partage une culture à travers les différentes disciplines de la santé publique, ce qui est la difficulté en santé publique. Il y a beaucoup de différentes disciplines, des sciences humaines, sociales et des sciences plus quantitatives qui contribuent. Alors l'objectif du réseau en conséquence est la formation pluridisciplinaire dans les différentes disciplines, donc l'épidémiologie, biostatistique, santé, environnement, économie, management, droit politique, sciences humaines et sociales, etc. On met les doctorants en pratique interdisciplinaire, et ça c'est ici le séminaire qui intervient, et aussi pour les encourager vers une expérience internationale. Le réseau doctoral peut être constitué de 10 écoles doctorales sur tout le territoire français, et actuellement comprend environ 80 doctorants. La nouveauté de notre programme sont ces séminaires interdisciplinaires qui donc mettent l'accent sur la pratique interdisciplinaire. Les doctorants ont le choix de leur sujet dans le domaine de la santé publique. Notre demande est qu'il y ait au moins 3 doctorants dans au moins 3 différents parcours de la santé publique, donc les différentes disciplines qui se rencontrent et qui discutent autour des organisations de séminaires, et donc aussi que le programme reflète cette interdisciplinarité. Voici, c'est la première édition de ce séminaire interdisciplinaire et je veux vraiment beaucoup remercier les organisatrices et organisateurs pour leur courage de se lancer dans cette aventure. Leur expérience va nous servir pour mettre au point ce dispositif, donc merci beaucoup vraiment pour votre courage. Et le réseau doctoral, ils ont travaillé en autonomie et le réseau doctoral a juste donné un soutien logistique et financier. Vraiment, ils ont travaillé en très grande autonomie. Et je remercie aussi beaucoup Madame Chêne pour votre participation à ce séminaire, parce que votre présence est quand même un très grand encouragement pour les doctorants et aussi pour le réseau doctoral. Merci.
I will continue in English just because I have prepared in English, so it's pretentious, but it's more easy for me. So no, I'm really delighted also to be here, just because as a teacher, of course, but also as the head of the institute and with national responsibilities, one of the important things is to think about the future, not only the past, but also the future. And the future, that's the young researchers that represent that perspective. And so, what I wanted to say to the young researchers, especially, two things. The first one is, what is ITMO, Multi-Organism Institute at the Alliance for Life and Health Sciences, and I'm sure that's useful also for those who are not young researchers, because sometimes it's not really known what is this alliance. So this alliance is a coordination, and just a coordination, so that's a really light, I would say, organization, but the coordination of all research institutions in their field. So for life and health sciences in France, the alliance is for INSERM, CNRS, Institut Pasteur, etc., etc. So INRA, INRIA, all the institutes that have researchers working in the field of life and health sciences. And so the idea is about the continuum, the interdisciplinary, and the idea that no researcher is able alone to think about all the impact that can have his or her own research. And so among this coordination, there are 10 different institutes, and public health is one of these institutes. There is one institute in cancer, etc. So the idea is to be cross-sectional, to coordinate these research institutions on a specific topic. Public health in France represents, among all research institutions, about 100 teams and about 500 researchers in organisms. That's much more than that, because there are teams that are not only in these institutions with a label from the highest evaluation institute, but at least that's these people. And what are we going to do in 2015 in this institute? We are going to prepare a new program or a new programming for research in public health. New programming means having ideas and having the money to do the research on the ideas. Of course, that's the critical thing, and this is at least a large part of my time to how to coordinate the funding and try to get funding for the researchers in public health. So this is what we're going to do. I cannot tell much about it because that's only starting, and of course some of you, if not all, will be involved in that reflection. At least I can say what is inspiring this new program. The first thing is that research in public health of today, that's the hope for a better health of populations tomorrow. And collectively, researchers in public health have an outstanding track record. So you know that in the past, those researchers, the researchers in public health have been those who identify the role of cholesterol or hypertension in cardiovascular disease, who showed that vaccine can have immune protection for major infectious disease in population, that hygiene is a big and very important determinant of major infectious disease, etc., tobacco and pulmonary cancer, etc. So there is a high track record, and the second thing is that the context with prevention is of course very important and a high priority on the agenda of the French government with the National Strategy for Health. So the national strategy the new National Strategy for Health has been launched in 2013, and in that strategy, prevention, and for public health specialists, of course, prevention is very important. Prevention is a high priority on this agenda. So, of course, the research in public health has changed a lot in the past 10 years or so, with recognition that, of course, a better knowledge of health determinants should be the driver of action. And so one thing that is a driver for this program is that our science, especially epidemiology, should become, but not only public health, should become a science of action in complement to a science of observation. The second thing is to think about how knowledge is driven in life and health science and comes to public health. It's driven today by basic science, by technology, and by politics and economy. And so basic science is absolutely crucial to better understand the underlying mechanism of disease, and so there should be a link to biologists that is stronger than we have today. Technologies to collect data, but also to intervene for health are becoming more and more important, and we should be linked also to the science of engineer, and politics and economy, and I would say also environment as a whole, as all human activities are interacting with health, not only health at hospital, but of course environment is linked, agriculture is linked, and nutrition, as we are going to talk today, of course that's really very important. So the challenge that you are going to face, not only me, because I'm just shaping the program, but now it's in your hand, or in tomorrow that will be in your hand, will be also to shape the infrastructures that you need to do better research. And one of the first things will be to maintain accurate, high-quality data collections. Without accurate information, you cannot take any sound decisions. Of course, big data is an extraordinary opportunity, but only if data is accurate and meaningful. The second thing is to establish a better continuum with the sciences. I've talked already about that. All the sciences that drive your own science in public health. And the third thing is to invent, at least in France, and probably we need to benchmark other examples, the right continuum between research and expertise. This is really, we need really tighter link between research and expertise and a better continuum in France. So that's mostly what is inspiring the program so far. So of course we need now to write and discuss among the whole community. And so I just finish with two things. The first thing is thank you in advance to all the speakers of today and all those who came from, who did a long trip to come here. And the second thing is to congratulate, I join, of course, Judith, to congratulate all the researchers, our doctorants, no, our PhD students, on the organization that is really outstanding. And so if it's a proof of concept, I think we should say already that it's a success. So thank you very much and congratulations to you, and I wish you intense discussion today and very fruitful discussions. Thank you very much.